As I was going through chiropractic school, I was really enamored of about the idea of treating people as a whole organism, right? Looking at people at a holistic model. So that's part of the chiropractic paradigm. So really early on in chiropractic school, after you've done all of your undergraduate training and you're entering into a graduate program, within the first year, you get a lot of the chiropractic philosophy classes while you're getting your basic science classes, just as any healthcare provider, including medical doctors, do. The first couple of years are basic sciences and the core philosophies of that practice. So with chiropractic was kind of first incepted, or the birth of chiropractic was thought to be when this janitor fell down the stairs of a school and lost his hearing. And the gentleman, his name was D.D. Palmer, he was working in that school at that time, and he hypothesized that when he fell down the stairs that he jarred his spine, and something in his spine caused his hearing to go away. So what he did is he examined his spine, he manipulated his spine or delivered the first adjustment, and within moments it's thought that the individual who fell down the stair got his hearing back. So it was like this miraculous discovery that the spine, or the articulation of the spine, or the movement of the spine, can have effect on the nervous system. So we're told this in our philosophy class, but then following that class in the next period, we go to like a CNS and a PNS class. And what we talk about is how in the peripheral nervous system or the central nervous system, that's CNS and PNS, you have different nerves that go to different organs. For example, you have your 8th cranial nerve that comes out of your skull through your external auditory meatus, which is essentially your ear hole, and it basically innervates the organ in your ear that you hear from. So we know that basically it goes from your ear into that skull, right into your brain, and that's how you hear. But then we also talked about how this individual had his mid-back adjusted and got his hearing back because they took pressure off of a nerve. For me, that gave me this cognitive dissonance. I didn't understand how you can say that there's pressure on a nerve in the back that's causing you not to hear. So I was just like, this is a bunch of nonsense, right? Hocus pocus magic, no science behind it. And nobody can answer my questions. So I applied to medical school. I took my MCATs, I got accepted, and then I met Dr. Carrick. And Dr. Carrick at that point in time was traveling around the world offering classes to chiropractors and other trained physicians about the neurology of manual therapies, such as adjustments, such as massage therapy, physical therapy, basically how those types of therapeutic procedures can actually change the nervous system. And as soon as I heard him speak, I was just so inspired to the possibility that lies inside chiropractic. Now, the word chiropractic itself means, it's a Greek word that means practice with hands. Chiro meaning hands, and practico meaning practice, right? So practice with your hands. So it really just, it put this idea in my mind that we have so much power just in our hands. We don't need other types of tools. As long as we have our hands and our knowledge, we can help tons of people. So I redirected my course back to chiropractic school, finished off chiropractic school, training in neurology the entire time. And throughout that time, as we're being educated, Dr. Carrick would frequently come to the university and see patients. And also, when he was seeing patients, we'd be able to see individuals with some of the most devastating neurological disorders, such as dystonia and movement disorders and tics. And their diagnosis would literally just melt away before our eyes as he would do things with his hands and eye exercises and different types of therapies. So for me, it just struck me really, really deep that this was something that I wanted to do. I would exhaust anything in my means in order to get to the point where I understood the human nervous system as well as Dr. Carrick did. So that's been an ongoing mission for me. I still continue to take hundreds of hours of classes every single year to try to kind of learn more, because as time goes on, right when we think we understand the nervous system, we realize that we don't. There's a really great quote that I like, and I can't say, I don't remember who it's by, but it says that if the human brain was so simple that we could understand it, we would be so simple that we couldn't. So it's really an amazing thing when you think about it. The brain and the understanding of neuroscience, it's just growing more and more every day. So on our side of the fence, on the clinician side of things, we have to be diligent about updating our education regularly. And that's something that everybody here at Plasticity Brain Centers does on a regular basis.